Alright, so I'm now post-op of my hysterectomy. It's alright. So, I'll just go through basically what it was like. The surgical process that I was conscious for, and what recovery's been like so far. Going into the surgery was basically the same as top surgery. I mean, you get admitted and they ask you all these questions, and you just get ready, and eventually you get the general anesthetic. And then waking up, when I woke up from top surgery, I was already back where I had started, like with my mom, and basically in my hospital room that I was going to be staying in. But this time I woke up in like I don't know what they call it, but like the post-surgery room or the recovery room or whatever, where it's like an in-between phase between surgery and the recovery room, or the room where you'll be staying. And so I had to wait there for a while, which wasn't that bad because I basically just took a lot of naps. But eventually they brought me into a room, and I went publicly to get my hysterectomy, because if you go publicly, it's fully covered by Medicare. I didn't have to pay for anything, including the anesthetic or the hospital stay. And I ended up actually getting a room all to myself, apparently, because I was trans, so I won't complain about that. That was quite nice, seeing as when I went privately to get my top surgery, I didn't get a room to myself, so that was an unexpected bonus. When I woke up, I had a catheter in. I knew that there was going to be something to that effect. I've never had one before, and it was really quite a weird sensation and pretty uncomfortable. I got a little bit used to it, but they took that out the next morning, and I felt way more normal and mobile, and that was just, it wasn't really very comfortable. The other thing was, obviously you have a cannula in your hand, you can see, where they put all the antibiotics, and if you need it, anti-nausea medication. And I hate needles, and especially I hate cannulas, and then whenever they would put the stuff in, it would take so long, and so that was kind of uncomfortable. And then the other thing that I was not expecting was that they kept coming in to give me injections in my leg for blood thinners so that I didn't get blood clots. So, I'm glad that they did that so that I didn't get blood clots, but like having them come in and unexpectedly stab me in the leg was not fun. They didn't really give me as many painkillers as they did for top surgery. For top surgery, it was basically a cycle between Panadol, and I think Panadol and codeine, and Endone, whereas they were only giving me Panadol for this one. I only needed to ask them for the Endone once, because I don't think Panadol really does much for me. And they did give me the Endone once, but I didn't actually need it much more than that, which is good. I didn't get up at all during the first night, but by the morning after they took out the catheter, I was able to walk around, albeit very slowly, but it wasn't as bad as trying to walk around after top surgery. So it was good just to be able to get up every now and then and move around, because it was really uncomfortable just staying on that hospital bed. And I convinced the doctor to let me leave that afternoon, thankfully. I think staying in the hospital bed was making things worse, just because I couldn't move and I couldn't get comfortable, and it's just that environment, and you have nothing to do, and you're just attached to everything, and it was just, as soon as I got out of that, I felt much better, and I have no complaints about the hospital stay though, in terms of the staff were all very helpful. There was always somebody there when I needed them, and whenever I would ask them what they were doing, they would explain everything to me and things like that. So that was all good. That was also slightly better than I thought it would be, because I've never been in a public hospital before, but it felt very similar to the private hospital. And after I got out, I was really happy to be out, a little bit sensitive. I couldn't really stay awake for very long. I'd still have lots of naps that day, and I think that was good for my body. I needed that. I had a really poor sleep in the hospital, and the day after that, I basically almost felt normal. I still can't really, it's been a few days now, I think 2 days, 3 days, I should probably know. Well, today's Tuesday and I had the operation on Friday, so you can work that out. I feel basically normal, except for that I can't really bend over and move my torso properly and things like that, and I still have a little bit of trouble eating very filling meals, but I can eat stuff like fruit and lighter meals quite easily. The only pain that I feel is external, where the incisions are. I have 4 incisions on my front. I don't feel any pain internally. I still have, I went and picked up some paracetamol and codeine, and I've been taking maybe about 2 of those a day. I've been trying to wean down to see how well my body is actually recovering. The other main thing that I should talk about, which has been making me pretty dysphoric, is that you will also have, or most likely have, bleeding. Not as much as when you're experiencing a period, but still enough that you will probably need to wear pads, which has been unfortunate. I haven't had to do that in over 2 years. But you don't get the pain that comes with it or anything like that. But just warning you that you probably will need to do that. So the surgeon said that will probably only happen for a few days. I think it's almost stopping now, but that's been the only other main thing that's been different from normal functioning for me, other than the limited range of motion and stuff like that. I've been sleeping alright since I got out. And you have stitches, dissolvable stitches, that you will limit what you can do for at least 4 weeks. So that's the other thing that's a little bit annoying, seeing as it's my holidays and I wanted to, enjoy it. But I'm glad that this is done now, and that, it's something that I knew that almost always, even as a child, before I knew the words for it, wanted to get done. So it's a good relief to get it over with, and now I'm just having to deal with the recovery, and then that'll be all I have to think about for it. So that's a pretty good feeling in itself. I think that's everything I had to say about it, and I will probably make another update around when the stitches are gone and how I feel around then. Alright, thanks.